Friday to discuss the Pfizer shot for boosters. Moderna and J&J are expected at a later date. Then the full FDA will take the advisory committee recommendation before CDC issues its formal recommendations on boosters. They are currently working toward an increased demand if the Pfizer booster is approved. The FDA and CDC are currently doing studies on mixing and matching vaccines from different manufacturers and hope to have recommendations on that as well very soon. Secretary Smith will talk more about our preparations here in Vermont for boosters. Next, as I announced last week, effective tomorrow, all our executive branch state employees will have to attest that they've been vaccinated or be tested weekly and wear a mask. We think this will make workplaces safer, and as we await more details about President Biden's executive orders, in the meantime, I continue to urge other employers to adopt similar policies as I have for weeks. The President's plan, he's encouraging vaccines. Because we're under a state of emergency, the state doesn't have the authority to implement such a mandate ourselves, but I urge school districts, who are the employers, to use the state as a model and take a similar approach. I've also asked the Commissioner of Labor to clarify whether school employees are covered under the OSHA rule being contemplated as employers with over 100 employees. Considering these steps is important because, once again, we know that vaccines work. Vermont is the most vaccinated state in the Union, and we continue to have the lowest hospitalization rate. Today, currently, there are now 43 Vermonters hospitalized with COVID-19. 36 of them are unvaccinated. Just 7 are fully vaccinated. So please, get vaccinated. They save lives. Finally, September, we recognize Suicide Prevention Awareness Month in Vermont and across the country. Secretary Smith and Mental Health Deputy Commissioner Allison Cromp will go into further detail we're doing, but I wanted to, unfortunately, the 8th leading cause of death among Vermonters. There's no denying the stresses of living through COVID-19 have increased many of the risk factors associated with suicide, including depression, social isolation, financial stress, unemployment, and challenges to mental health. Vermonters have shown our resiliency and support for our communities throughout the pandemic. Every suicide in Vermont has a terrible impact, and we must each do what we can to prevent these losses. It's important we address the needs of family members, friends, and they at a higher risk, including those who live in rural areas, as well as older Vermonters, and those who identify as LGBTQ+ and BIPOC. It's also important we recognize those who work on the front lines of suicide prevention, our local educators, mental health professionals, first responders, parents, friends, and more. By joining those around the globe in recognizing World Suicide Prevention Awareness Month, it's a reminder of all the actions we can take to help those in need. There are many resources and support services available. You can go to vtspc.org and learn more about awareness and how to talk to someone you think may be at risk. Ask if they're okay and offer to help. I encourage Vermonters to come together, support each other and the people in your lives who may be struggling. Again, Secretary Smith and Deputy Commissioner Cromp will go into further detail in a few minutes, But first, we'll turn it over to Commissioner Picha.
Thank you very much, Governor, and good afternoon, everybody. Similar to the last few weeks, when we look through our data today, we'll see signs that point to optimistic trends, but we also see signs that point to some cautionary trends as well. So I want us to keep both of those items in mind as we work through the presentation. To start with, when we look at the national data, you can see that the 7-day case rate after Labor Day continued to trend down. For the past 7 days, it's down about 10%. But also be mindful that we're still waiting to see if there are any impact from Labor Day, and there's also still some data anomalies with the national data because of reporting delays in other states. So again, the trend is looking good, but we want to be mindful of that. On the next slide, you'll see the growth rate that we've been talking about for the last probably 5 or 6 weeks. The growth rate had slowed week over week. And finally, this week, you can see it's gotten into the negative. So the growth rate across the country has declined below zero, meaning cases are actually falling, not just that the rate of growth is decreasing, which is certainly, again, a good sign and something that points toward some signs of optimism. Another sign of optimism is the national hospitalization rates that you see on the next slide. So unlike the data that can sometimes be, jumpy on the case side, particularly after a holiday or some other event where cases aren't reported, hospitalizations continue to be reported through those weekends and through those days. And again, you can see here that the hospitalization rate has ticked down nationally in the country. Again, another good sign. Again, when we look at the national picture and we look at where the cases have been decreasing week over week, we see that those places in the southern part of the country that were hit the hardest, earliest with the Delta wave are the ones that are seeing the improvement. When we look up to the northeast, you see that Vermont is down a bit from last week, same with Connecticut, but it's not a universal story across New England or the region. We certainly would like to see the region, New England states in particular, all trending down, moving in the same direction, and we're not quite there yet. So Vermont has seen improvement, another New England state, Connecticut has, but that's only a piece of the regional puzzle. Talking about Vermont, as we mentioned, again, we've been talking a lot about that growth rate. You see here that the growth rate did continue to decline. And again, like we said here in Vermont, it went below zero, meaning our cases decreased over the last week compared to the week before. You can see that on our 7-day average when we go to the next slide. We've reported about 86 fewer cases this week than we did last week. But again, when you look at that 7-day average, the trend is down, but it's not a clear trend down and it hasn't been sustained yet. So that's the point of caution, certainly, that we want to take into account. Looking at where the cases are across Vermont, on the next slide, you'll see that Washington County has seen some improvement. That was a county that was particularly high last week. Chittenden County, a little bit higher than last week, but still relatively stable. The Northeast Kingdom has seen some increased case counts, particularly in Orleans and Essex County. In the southern part of the county, relatively stable, although a bit higher than it has been in the past number of weeks. Looking at the age groupings, and particularly focused on younger Vermonters, since there's been a lot of discussion, certainly in the national media, about case rates among younger Americans. We can see that in Vermont, those age groups that are below those that are able to be eligible for vaccination are higher on a per capita basis than the total Vermont rate. You'll see that that 15 to 18-year-old age group is lower than the national average. They're eligible for vaccination. They have a really good vaccination rate relative certainly to the rest of the country and even other age groups in Vermont. But you do see some elevated case counts there in the younger Vermonters. But again, we've been fortunate. I think today there's one pediatric hospitalization, but generally these cases have not resulted in hospitalization, which is something we're certainly fortunate about. Looking at the next slide, again, a couple of more trend slides that show that the reproduction rate is still below zero. Again, when it's below zero, you anticipate cases will be dropping. We did see that this week. It continues to be below zero. We hope that that will continue, but again, just a note of caution there. And then finally, looking at the case model, we see that the model that we had from 2 weeks ago, we overlaid the actual case growth onto that, and it's relatively similar, and it's anticipating really this week, the next week would start to the hospitalization rates are not going up because of those who are not yet eligible. It's really that eligible population that has not yet gotten vaccinated that's driving those hospitalization rates. So again, all the more reason to go out and get vaccinated. Looking at our higher education update, you'll see that now all 16 of the higher ed universities and colleges are reporting. The vaccination rate at the moment stands at 93.6%, so a really high vaccination rate. You'll see that the exemption number stands at just under 2.5%. There's a few hundred students that are still in that to be determined category, but that vaccination rate across campus, very strong. And you'll see the weekly positives and case numbers there. If we go on the next slide, you'll see a comparison of the fall 2020, 21, fall 2021, the first 3 weeks that the higher education was on campus. And you can see, obviously in the fall of 2020, when cases were very, very low, the vaccine wasn't available to us yet, but college campuses were quite quiet during the first 3 weeks. During the spring semester, cases were much more elevated after coming off of the holidays, that winter surge that we saw. Again, the vaccine not yet available, and the cases were much more elevated. The first 3 weeks so far of school, the cases much lower than we experienced in the spring of 2021. Again, a big difference being that really high vaccination rate that we're seeing across campuses. So far, continues to be pretty quiet on the higher education campuses. Looking at the active outbreak slide for long-term care facilities, the same number of outbreaks as last week, which we reported being 7. The number of cases up a little bit, 134, compared to just about 100 cases last week in long-term care facilities. And then finally, turning to vaccination, you'll see that Vermont added another 2,243 individuals to the vaccination rolls this week. That moves us up to 87% of those who are eligible who have gotten vaccinated. But when you look at the next slide, we haven't looked at this slide for a while, but you really see 2 age groups that stand out in terms of their low vaccination rate in Vermont. That 18 to 21-year-old rate and that 22 to 29-year-old rate, which are about 54% and 66% respectively. So again, particularly those younger Vermonters, really need them to step up and get vaccinated. For those who are their parents, their uncles, aunts, friends, to encourage them to get vaccinated, because they're really a key piece of the puzzle here that we're currently missing. And then when we look at our vaccination rates overall, you see that Vermont continues to be #1 in most categories, particularly fully vaccinated, which is certainly with the Delta variant is critical. And then we continue to be #3 on those starting vaccination who are eligible. But again, on most of those categories, continuing to be #1 in the country. So at this time, I'd like to turn it over, I believe, to Secretary French.
Thank you, Commissioner Pichek. Good afternoon. Later today, Dr. Levine and I intend to issue revised recommendations for the contact tracing process in schools. I thought I would highlight some of the changes that we're including in our new recommendations. Contact tracing is an important strategy to ensure the safety of our communities and our schools. The Delta variant has put pressure on the contact tracing process because it spreads more quickly than other variants, however. In our revised recommendations, we are not making any changes to the standards for contact tracing, but rather we're trying to make the contact tracing process more responsive to the dynamics of the Delta variant. In short, we want to make it easier for both schools and contact tracers to implement the science behind contact tracing. Central to our changes is enabling schools to move more quickly to identify students who are vaccinated. A student who is vaccinated and asymptomatic is not a close contact under CDC or Vermont guidelines. Previously, schools had to wait for vaccination status to be confirmed by the health department. We are now going to enable schools to use their local vaccination information to make this determination. We published recommendations for how schools should determine the vaccination status of students. Schools should use our template form that asks parents to attest to the vaccination status of their children and to show a copy of the student's vaccination card or record. We are also providing recommendations for common areas such as cafeterias, school buses, and playgrounds. Whole lunchrooms should not be automatically quarantined. A risk assessment should be performed to determine a student's physical proximity to a suspected case. Anyone within 6 feet of an infectious person for 15 minutes or more is considered a close contact. This kind of risk assessment can be challenging to implement in the dynamics of a busy school lunchroom. So we are recommending seating charts and, when possible, having classes eat together. Many schools will continue to use other spaces for student meals, such as classrooms, in addition to cafeterias. For school buses of students should not be automatically quarantined. A risk assessment should be performed that considers the physical proximity to a case and to what extent there was consistency in masking. The CDC requires masks for all passengers on school buses. In terms of playgrounds and recess, we are following a similar approach and do not recommend automatically quarantining all students on playgrounds, since the risks to students outside are far less than those when they are inside. A school should notify families of a potential exposure during recess or outdoor time and make testing recommendations for 3 to 5 days after the potential exposure, but not put students in quarantine unless they are identified as a close contact. A template letter for handling these types of potential exposures will be available for schools on the Health Department's Pre-K through 12 schools website. The recommendation to test rather than quarantine is a central feature of our revised recommendations. When a student is not a close contact and their exposure status is uncertain, we are recommending testing as the first strategy rather than quarantining. All schools have the ability to sign up for surveillance testing. This testing is free of charge and available for students and staff regardless of vaccination status. I would like to see all our schools involved in surveillance testing this fall. Surveillance testing was an important strategy for us last year. It will be very important for us this year as well, particularly as we head into the winter months. In terms of keeping our schools safe from COVID-19, vaccination is our priority strategy. It will be increasingly important to ensure all students are vaccinated, and I certainly strongly encourage all parents to get their children vaccinated. Vaccination will not only keep our schools safe, but also allow us to continually operate in-person instruction, since it greatly contributes to the efficiency of the contact tracing process. In terms of vaccination, I thought I would provide some specifics on the student vaccination incentive program that we're working on. The intent of this program is to leverage federal COVID-19 relief funds to incentivize student vaccination and to provide opportunities for students to direct the use of these dollars. The grants will go to schools, not directly to the students. The governor has committed up to $2 million in federal funds to encourage student vaccination. $1 million would come from the CRF funds and $1 million from the state set-aside of ESSER funding. All schools will be eligible for a one-time grant award, a bonus award, and the governor's cup. Amounts will be based on total school enrollment and vaccination rates above 80%. At 80%, schools may rescind their mask mandate for eligible students. Students under 12, however, would still be required to wear masks. When a school has a vaccination rate of at least 85%, it would become eligible for a grant award based student with a minimum award of $2,000 and a maximum award of $10,000. A school with a student vaccination rate of at least 90% would also be eligible for a bonus award that would be 50% of the first grant award. Once eligible for the grant program, a school must submit a grant proposal to spend its incentive award. Grant proposals must be developed through significant input of the student body. When the school obtains a student vaccination rate greater than 95%, the school will be entered into the Governor's Cup Award. 3 random drawings will be conducted among these eligible schools, one for small schools, one for medium schools, and one for large schools. The winners of these drawings will receive an additional $10,000 award. We'll have more details on this program in the coming weeks. Lastly, we're starting to work on our approach to winter sports. I strongly encourage all our student athletes to get vaccinated prior to the winter season. Also encourage our athletes in particular to participate in the surveillance testing that will be offered in many of our schools. We intend to publish our recommendations for winter sports in early October at this point. That concludes my update. I'll now turn it over to Secretary Smith.
Thank you, Secretary French. Good afternoon, everyone. I want to provide updates on a couple of topics this week. It'll be a little bit of a change of format than we're normally used to. So let's begin with testing. Vermont has maintained its testing infrastructure that was built up over the pandemic. We established 33 state testing sites throughout the state, and we kept that infrastructure in place. Pharmacies in the state provide an additional 21 sites. In fact, this is the reason that, according to the CDC, Vermont is consistently in the top 5 in the nation for testing its residents. Over the last 7 days, according to the Health Department, Vermont performed approximately 36,000 tests. In addition, we monitor lab turnaround times. For example, tests performed between August 29th and September 4th, the latest information we have, shows an average turnaround time of 1.6 days, or a median of 2 days. In the past day, we've heard of delays which we are looking into, perhaps caused by data entry issues with walk-ins. Where we find that there are delays or not enough testing, we will add capacity. Adding capacity may include expanding existing sites, adding new sites, or looking at other options like self-service test kits. We also need Vermonters to help make things run more smoothly. One of the biggest differences between now and last fall is that when demand was low, we shifted from appointments only to allowing walk-ins. Now we are transitioning back to appointments because just showing up in a higher demand environment causes people to wait. I mentioned this last week. Please make an appointment for testing and try to avoid just walking in at a test site without a reservation. You can make a reservation easily by going online at healthvermont.gov/COVID-19/testing or visiting your pharmacy's website. In addition, we're gearing up for testing for those state employees who are not vaccinated. We'll have more to report on that in the coming days. We also have, as Secretary French has talked about, working closely with schools to expand weekly surveillance testing. Many districts expressed an interest in participating in this new program. By the end of September, more than 101 schools will have testing programs up and running. That represents more than 37% of school districts, with an additional 50 schools slated to start by mid-October, or more than 52% of school districts. We are working closely with schools to determine what's needed to support them in overcoming barriers to get tested, or to getting started earlier, or encouraging other schools who have not yet signed up to participate. That said, we're excited to see the success they are having in getting students back to full-time in-person learning this fall. Now, turning to our correctional facilities. As for COVID testing at Northern State Correctional Facility, they have had 2 consecutive rounds of all negative test results for both staff and incarcerated individuals. The facility has returned to modified operations, though there will be another round of testing next week before the facility is fully cleared of all outbreak protocol. Outside visitation is open at Chittenden Regional Correctional Facility and Marble Valley Regional Correctional Facility. The other 4 facilities either have COVID positive cases or in some phase of follow-up COVID mitigation. In order for these facilities to open to outside visitation, there needs to be 0 COVID positive staff and incarcerated individuals. In terms of reporting case counts, there are times when we have to revise previous days' numbers. We strive to publish the most up-to-date and accurate information on the number of positive cases as quickly as possible. We've also implemented some changes in our technology and added personnel to lessen this occurrence. We will consider additional changes if needed, but the bottom line is we need to do a better job. I also want to mention contact tracing because we've added even more resources lately in this area. In the spring, to allow some in our state workforce to return to their normal jobs, we augmented contact tracing by hiring a contractor. The contract calls for them to increase their workforce as COVID-19 positive case counts increased. Recently, they failed to do that sufficiently, leaving the state to fill the gap. So as of today, We have increased our overall numbers in this area to 104 full-time equivalent employees performing contact tracing, including reaching out to those close contacts, and performing other associated duties such as reaching out to businesses and schools. We will continue to add state workers, our National Guard service members, and additional contracted employees as needed. Also, as I said last week, we've been planning for the rollout of the booster doses once the federal government authorizes them. We anticipate that the first people eligible to get booster doses will be healthcare workers and those who work and live in long-term care facilities. The goal is to have a fast and efficient way for individuals in long-term care facilities to get vaccinated. We already have spoken with our licensed long-term care facilities in the state to ensure that planning is underway for boosters. We have spoken with all skilled nursing facilities in the state. All of these facilities in Vermont have reported that they have access to a vaccine partner. After this first group, we'll turn to providing booster doses to the general population. At that point, Vermonters should expect to start hearing about larger vaccination sites. When we get to this phase, you will need to make an appointment to get a booster. However, we are not currently taking appointments for booster shots for the general public. We will have more clarity once the federal government provides us guidance. In addition, I want to provide a brief update on opening additional capacity in mental health beds. At the Brattleboro retreat, they plan to have 65 beds available by September 20th. They have had 47 beds available for some time now, and they are currently at 54 beds. From there, the goal is to increase overall hospital capacity to 75 beds by October 1st. That will include a target of opening 6 Linden Lodge beds. These are new beds that will be open. As for the Vermont Psychiatric Care Hospital in Berlin, since mid-July, we have onboarded 13 registered nurses, including 5 who started today. It's our hope to have 9 beds open as soon as possible. Turning to vaccination rates, as you've heard, as of today, 87% of eligible Vermonters have received at least 1 dose of the vaccine. That means 77.8% of all eligible Vermonters are fully vaccinated. You can walk in and get vaccinated at most local pharmacies. You can also visit pharmacy locations at the community health centers of Burlington, Northwestern Medical Center, and the Southwestern Vermont Medical Center. In addition, we will be sending out a press release detailing the 23 school-based clinics and pop-ups available this week. Again, I do want to note that in the coming weeks, these pop-ups will be scaled back as larger clinic sites are reintroduced for vaccines and boosters. You can find information about these pop-up sites at healthvermont.gov/myvaccine. Lastly, I want to just briefly add on to what the governor said about suicide prevention. Over the past several years, state agencies and departments have been working closely with community partners to expand and improve the services and supports they can help to prevent suicide. Suicide is not just a mental health issue. It is also a public health issue. Vermont took an important step in acknowledging this fact when we chose reducing suicide deaths as a public health measure for monitoring how well we are doing at implementing our health care reform goals. The cause of suicide is complex and requires a multi-pronged approach to make an impact. I am encouraged by the work of the Mental Health Integration Council as they implement strategies to integrate mental health into the healthcare system so every Vermonter is supported by the right level and type of care at the right time. I especially want to thank the leadership of Commissioner Haas and Deputy Commissioner Cruff at the Department of Mental Health for providing the support that they have done. As I and the governor have noted, the pandemic has created a host of difficult challenges for Vermonters who may be at risk, as well as for our ability to provide critical services in this era. It's been a challenging time, and I think Vermont has stepped up and continues to step up during this time. I'll now turn it over to the Deputy Commissioner.
Thank you, Secretary. The Secretary and the Governor have mentioned the incredible work done by our mental health and healthcare workforce in supporting tens of thousands across the state. I would like to take a moment and say thank you to the dedicated clinicians and support staff who've continued to deliver mental health support to individuals throughout the pandemic, all while they manage their own pandemic-related stressors, their own mental health, and that of their families. I encourage them all to take a breath when they can and to make sure they're caring for themselves throughout this work. The COVID-19 pandemic has made care delivery all the more complex, but our ability as neighbors and peers to care for each other has shown through as a strong and enduring force, a testament to the unique way we as Vermonters can be there for one another through the good as well as these more challenging times. During my time in Vermont as a suicide prevention coordinator, I've spoken to so many people in the state who've been touched by suicide. And as a clinician, I've sat with individuals contemplating suicide themselves. It is so important that their stories and the stories of others with lived experience continue to shape the way we approach suicide prevention in Vermont. As Secretary Smith mentioned, suicide is not just a mental health issue. The Department of Mental Health is grateful for the partnership of the Department of Health, who's helping us approach suicide prevention from a more holistic population health lens. While September is an opportunity to raise awareness around suicide prevention and promote mental health awareness, we all have a role every day to address this important issue, impacting our communities and our families. Reaching out, staying connected, and checking in with one another, all of these are ways that we can help alleviate the burdens often felt by those experiencing suicidal ideation. And when you reach out to check in on others, it actually improves your own mental health as well. Here are a few other things each of us can do to prevent suicide. Take time to learn about the signs of suicide risk and what you can do. Resources like #BeTheOne2 provide simple guidelines for supporting others who are struggling. You can visit the Vermont Suicide Prevention Center's website, vtsbc.org, and there you can find custom local resources and events. Support your own mental health. Take time to check in with yourself. Ask how you're feeling. Staying in touch with your emotions can help improve your mood and lower your anxiety. Practice self-care to help you cope with everyday stress and prepare yourself for stressful situations. Learning how to manage stress in healthy ways can make you and the people you care about, as well as your community, stronger. If you know someone who is struggling, please reach out. If you are struggling, talk about it. You can reach out to resources that are available 24/7, such as the Suicide Prevention Lifeline, the COVID Support Lifeline, or if you'd rather text, we have a 24/7 crisis text line. You can reach that by texting the letters VT to 741-741. For the Suicide Prevention Lifeline number, that number is 1-800-273-TALK, and it is now being staffed 24/7 by local Vermont mental health workers to support our state's callers. It is also free and confidential. Throughout September, we'll be shining a light on the resources that are available for people who are struggling, as we also continue to expand our suicide prevention efforts with upstream programming and shaping a more integrated approach to both mental health and wellness. By addressing the stigma around asking for help, improving our care systems, and listening without judgment, we as Vermonters can come together to build resiliency and support one another. Lastly, as the Governor mentioned, we encourage all residents to take the time to inquire as to the well-being of their families, friends, and neighbors over the next few days, and to genuinely convey their appreciation for each other in any way that they deem appropriate. A simple phone call, a message, can go a long way towards helping someone realize that suicide is not the answer. Thank you.
Good afternoon. I'm going to start off with a recent morbidity and mortality weekly report released by the CDC on Friday. It monitored the incidence of COVID-19 cases, hospitalizations, and deaths by vaccination status this spring and summer when the Delta variant became predominant. The report found that people who were not fully vaccinated were more than 10 times more likely to be hospitalized and 11 times more likely to die of COVID-19 than those who were fully vaccinated. These are the major outcomes we always look at with vaccines. And while the reduction in risk for infection was less dramatic, it was still highly impressive, showing that people who are unvaccinated were 5 times more likely to have an infection than those who were fully vaccinated. This real-world data suggests high and continued vaccine effectiveness against severe COVID-19, including the Delta variant. This is why getting vaccinated is still the most important way to protect ourselves against the virus, and why our rate of 77.5% of eligible Vermonters who are fully vaccinated still matters so much, even in the face of this highly contagious variant. However, the Delta variant has greatly driven up COVID transmissions around the country, including here in Vermont. As we've noted before, the ability of this strain of the virus to jump from person to person is significantly greater than the original strain, which touched off the pandemic in such a short time. This is why we must all think once again about the choices we make as we go about our lives right now. We need to consider the risks once again of large gatherings, crowded places, where and how we travel. Fortunately, we still have tools and knowledge for slowing the spread. Wearing masks indoors, getting tested, getting vaccinated, and staying home if you're sick. The more we all use these prevention tools and make smart choices to avoid risky activities right now, the more we can protect our communities, which includes workplaces, long-term care facilities, child care facilities, and schools. We have seen and will continue to see cases in schools because many children can't be vaccinated right now. But we know going to school is still critical for children's learning and social and emotional well-being. So, though many parents and caregivers are already likely taking more precautions, and I thank you, I'd like to remind everyone that even if you don't have children or someone else in your life who may be vulnerable to the virus, you can still help by giving the virus fewer chances to spread during this Delta surge. You can also help us move more quickly against this new variant by knowing what to do if you do test positive or are in close contact with someone who does. Here it is. If you have COVID, isolate yourself right away and reach out to your close contacts. If you're a close contact, get tested and quarantine as appropriate. Don't give the virus another way out. You can continue to find the information you need at healthvermont.gov/COVID-19. Speaking of children, pediatric cases are in the news and on our minds, and I'd like to say a few words about them. Frankly, there are frightening reports from other parts of the country of cases and hospitalizations. 2 other CDC morbidity and mortality weekly reports published last week looked at illness in children since the Delta variant arrived. And these reports provide additional lessons about vaccines. First, COVID-associated hospitalizations since Delta rose nearly 5-fold among children and adolescents, with hospitalization rates 10 times higher among vaccinated than unvaccinated adolescents across the 14 states involved in the study. In the second report, an analysis looking at children ages 17 and younger, COVID-related emergency department visits and hospitalizations were found to be about 3.5 times more frequent in states with the lowest percentage of the population vaccinated compared to states like Vermont, with the highest vaccination rates. This again shows the power of community vaccination and other prevention measures in protecting our children. According to the American Academy of Pediatrics, of all the states, Vermont has the third lowest rate of COVID cases among children. But third lowest is not none. We've had 5 pediatric COVID hospitalizations this year, with 1 currently hospitalized, all since Delta arrived. And we see clear difference in COVID in Vermont pediatric case rates when comparing those eligible for vaccination with those not eligible. If you look at the gold line, that is the oldest age children, 12 to 18, who are all eligible for vaccination. You see that nicely flattening out at a rate of 16.1 per 100,000. When you look at the children who are either ages 6 to 11 or 0 to 5, you see the rates are almost twice as high. These children are, of course, not yet eligible for vaccination, though we hope that will occur into the fall. This is yet another example of the power of vaccination and its impact on our pediatric population. So once again, vaccination is still our strongest and most protective defense against COVID-19 right now, even protective for those who have not yet or cannot yet receive vaccine. I'd like to also briefly address the health department's reporting of daily case numbers. We're glad that the data has been so informative and useful, and I want to thank our data teams whose behind-the-scenes efforts are simply above and beyond. It's an important point to know that our infectious disease surveillance data is reported as provisional and subject to change. In fact, that statement is on the Health Department's Reportable Disease Data webpage. It applies to pretty much every piece of data we report. In a real-time, fast-paced pandemic, we are always balancing the need to provide data quickly with the work that has to be done to make sure it is complete and accurate. COVID-19 data is reported as completely as we know it to be on any given day, and it is updated as new information is learned and reviewed. In recent weeks, like earlier in the pandemic, large numbers of cases have been added to the prior day's case count as lab reports from the prior day are investigated. We're working, as you heard from Secretary Smith, to reduce that number and have implemented some changes in our processes, but it does not affect our ability or the public's ability to see and analyze the data once it is complete. I also want to update you on where we are with booster shot planning. Very simply, a CDC advisory group is meeting on Friday to discuss data related to boosters, and we will keep you updated as soon as we have more information to share. While I feel somewhat confident about the fact that patients in nursing home facilities will be prioritized and have boosters, I cannot be confident of anything beyond that at this time. On a final note, I'd like to bring attention to a project the health department's working on with the University of Vermont to better understand the current health status of people who have tested positive for COVID-19. We are reaching out to Vermonters as part of this project, and the effort will help the state's healthcare system respond and adapt to the effects of COVID-19 on the health of Vermonters. About 2,500 people have been randomly selected to participate. So if you had COVID-19 in the past 6 months, you may get a call or an email from the university. If you're contacted, please answer the phone and return the call or reply to the email. Your help will be greatly appreciated, and any information you give will be kept confidential.
Thank you, Dr. Levine. We'll now open it up to questions.
Starting with folks in the room.
Governor, have you given any thought to bringing in a special prosecutor to investigate new evidence filed in federal court showing that state officials knew about the misuse of funds at JP and yet continue to take money from defrauded investors to finish the Burke Hotel?
I have not contemplated a special prosecutor at this point. Wouldn't rule it out, but have not considered it. We are relying on the advice of our counsel, the Attorney General, and his office and staff that have been conducting the investigation from the beginning and representing the state in this matter, and continue to represent all the different employees that were considered involved.
Are you aware that the Attorney General's office was directly involved in the Burke Hotel continuation of the fraud by virtue of paying the contractor in 2015?
Considering it's a different Attorney General, no, I'm not concerned about they being specifically involved, and I believe that they are acting in our best interests as our attorneys.
Are you willing to call for the release of state records?
I have been, again, from the very beginning. I think we should be dispersing those documents quicker than we are today. I've been advocating that with our counsel, but he is the Attorney General's office is the holder of those documents, and it's part of their legal strategy not to do so. But I'll continue to advocate, and hopefully we'll come to some conclusion, because I believe that they should be out in the open.
And why do you think the Attorney General has not released the records that are now in federal court under seal, for example, that get into some detail about this? Why do you think?
Again, part of his strategy, or maybe a better question for the Attorney General.
So is his strategy to hide the state's role?
I wouldn't say it's their strategy to hide the state's role at all, but it's just part of their legal strategy that they've been utilizing from the very beginning. And I can't question what they're doing, or I can question it, but again, we're relying on them for their legal expertise.
Wouldn't you want to get to the bottom of this?
Yes, absolutely, and I believe we will. It's just taking more time than any of us had hoped.
Commissioner Pediatric, maybe Governor too, getting to some of the data that we're seeing. I mean, we were hearing, I guess last month, we were looking toward Israel. Of our data is eventually going to come down, our cases are going to come down, but it seems like we just keep hearing the same thing week over week in terms of the cases and maybe where they're going. I guess what is really kind of the bigger picture forecast here? I mean, are cases ever going to come down?
Again, we didn't expect that this elevation of cases this early, but we thought it was going to happen later in the fall. But here it is, and it's affecting all of us with this new Delta strain. I think, again, it's good news that it's flat. It's elevated a little bit more than we had hoped, but we are certainly down below most other states. But I think it's a combination of factors. We have reduced restrictions a great deal from 6 months ago. We've lifted the state of emergency. We have 80,000 kids in school. There are many, many more outdoor activities, indoor activities that people are taking advantage of. So it's a different atmosphere out there. And again, with a combination of having more visitors from out of state and all the activities that have happened since the end of the summer, I've been concerned for a few days. I think I mentioned it last week, what effect Labor Day will have, and all seen a dramatic rise, but we did see an elevation today, and I'm not sure. We'll have to just wait and see whether this is as a result of those activities about 8-9 days ago, Labor Day weekend.
Yeah, thanks for the question, Calvin. Just to be clear, the cases did drop this week by about 86 cases compared to last week, and for Vermont, we're about 9 weeks into the Delta surge. So when you do look at other jurisdictions, whether in the United States or internationally, it was that 7 to 9 week period where they started to see their cases slow and then ultimately drop as well. So, we're in that same framework. Still, we're sort of cautiously optimistic about whether we're going to continue to see that downward trend. But the country as a whole, hasn't seen that same downward trend in a uniformed way, but parts of the country have. We're a much bigger country, more diverse than many of these other jurisdictions that we looked at. But again, those areas of the country that were hit earliest, 7 to 9 weeks later, they did see their cases come down. You can see some other states out west, even Alaska and Oregon, which were more recently, hit hard. They're starting to see their cases come down. So it's still following that similar trajectory. We're, again, cautiously optimistic about what that means in Vermont, that they actually did fall this week. But we'd like to see some more data before saying that it's a clear sign that it's trending down.
Secretary French, are the contact tracing changes that are happening in schools, you mentioned some issues. Are those issues related to what Secretary Smith was talking about with the contractor not sort of rising to meet the demand of Delta right now?
Yeah, I think there's two variables. One is capacity, and I think that's the kind of Secretary Smith was addressing. And so we, to a certain extent, aren't surprised, because there is a lot of virus transmission happening. I think, again, from my perspective, really watching what's going on in the hospitalization rates is really a critical part of that. So we're not seeing a similar commensurate uptake in the hospitalizations. So that's good news. That activity for schools to manage.
The federal government is going to make any change with respect to.
I haven't heard that they are in security. That
Governor, regarding the new contact traces, what is this contract with CICS? What is is protected?
Secretary Gideon.
I'm not sure I understand the question, but let me try to answer a question I'm not sure I understand. With contact tracing results every night, lab results of positive cases, and of course that's protected health information. Reach out through contact tracing to either the person who is a positive or the guardian who's a positive. So there isn't there are other sort of people that may be involved in it, but they all have sort of a need. That's not the right phrase, but I'm going to use it for this purpose. Is a need to, in terms of the criteria of HIPAA criteria for this information. We've never had a problem with that, and I don't suspect we're going to have a problem in the future on this.
I don't know if I said contact tracing. I think I meant surveillance testing, the new surveillance testing program. I don't know if that changes your answer or not.
But we haven't had a problem in our testing protocol in terms of your surveillance testing and the labeling of your test and who it goes to. We're pretty careful on that. So unless Secretary, I think we haven't had a problem in the past. I don't foresee us having any problems in the future. So I've answered contact tracing and surveillance testing.
I also have a separate question for Commissioner Harrington as well, if he's on. Can maybe Governor too? I mean, can you know what's happening right now with that additional $25 unemployment signed into law by you, but I guess now.
Commissioner Harrington, I'm hearing with the legislature right now, but we Commissioner on described benefit by the legislature. It's in as the supplemental. There's part of the right there. It's called supplemental. The unemployment trust fund legislature. And to try and fund purpose other than this was use of the funds. They had determined after a long period of time something that we can utilize out of the trust fund means that it will have to cleanse the general fund. So again, this is I know that there's a lot of conspiracy theorists out there that feel that this is dark and mysterious that happened, but it really is about the federal government just saying this is not appropriate. And we have to regulations. Now we have to go back to the drawing board with the legislature to see where to get the money from.
At least one lawmaker for Commissioner Harrington's resignation. I mean, what do you make of that?
If I was to ask a cabinet to resign to them following the law, that would be inappropriate in itself. Bottom line is he was job, and we again we're entrusted to protect the unemployment trust fund, and we're doing just that. We're just trying to follow the law.
Governor, with the appointment of the federal bench, that's going to open up another Supreme Court opening. Have you started looking?
No, I mean, that goes through the regular process. So I'm sure the court is well aware of this. And then we'll have the judicial nominating board involved as well. So this will take some time. If she's confirmed, which I hope she is.
I was going to on her appointment.
No,
actually.
no, I've they put forward to us. So.
All right, starting with Lisa Rathke.
Over the last number of days here, we've had 5 or 6 deaths of COVID, if I'm reading this week. It's yesterday, and then 7 over the weekend and 1 Monday. I was wondering if Dr. Levine could give us any more information about them. Were any of them in long-term care facilities? Were they among unvaccinated or anything like that?
Sure, thanks for the question. I can give some generalizations without getting very specific. If you look at them in aggregate, they're not all that different from previous deaths. First of all, each and every one of them unique and tragic in its own right. But secondly, combination of people who have been vaccinated or not. More of them have frankly died of COVID, severe complications of COVID. There were times in previous deaths where that COVID was a contributory cause, but many of the more recent deaths, COVID is clearly implicated in the death very directly. Again, there have been residents of long-term care facilities, but that's not the entire group. That's only a small number of them. Does that pretty much give you what you need?
Can you tell us anything more about the ages and how many deaths have there been since Saturday?
I don't have the number at my fingertips. I'd like to say 5, but could be 4, could be 6. And ages have been 50s through 90s.
Okay, and then I also wanted to ask, is Vermont seeing any healthy people getting an extra dose before the boosters are approved?
Yeah, that's a really good question. Just to put it in context, as more and more discussion about boosters occurs, there are individuals who are taking it into their own hands and hoping that they can walk into whatever site they want to walk into and ask for a dose of whatever vaccine and get it. There's also very conflicting guidance coming out from people who are frequently quoted in the press, some of whom are very much against, some of whom are saying that seems reasonable. So puts people in a very challenging predicament, which is why I've been saying we need to wait for the science to be reviewed adequately and the appropriate guidance coming forth. Our state-run vaccine sites, and as far as I'm aware, all of the pharmacies are really very good at making sure that they know what person is asking for what, and are they indeed due for that dose of whatever they're asking for. So I've not heard a lot of instances of people getting a special dose, if you will, that they would call a booster. The ones that we have the most concern about are those who are truly immunocompromised, who can and should indeed be walking in and saying, I have an immunocompromising condition and I would like a booster. So that's the group that we're really focused on until we have other guidance. But I'm not hearing a lot of individuals who have succeeded in just getting a dose because they felt it was the right thing to do. But it's not a metric we can really accurately follow for you either.
Okay, thank you.
Ed Barber, Newport Daily Express.
Yes, good afternoon. I have 2 questions. The first one is I'm trying to figure out how you thread the needle in that last year at this time. We had the COVID virus. We didn't have a vaccine. We've had all the safeguards in place for students, including social distancing. This year, with the Delta variation, which does make our kids vulnerable. We don't do the social distancing in the schools. We talked about doing it on the school buses, but in the schools themselves. I'm trying to figure out if the science was that the social distancing was critical last year, why is it not just as critical this year among that younger population where the Delta mutation is especially lethal?
Well, I think for one thing, I'll let Dr. Levine answer this, but the science, the data, we learn more about this virus every single day, and what we thought in the beginning is sometimes not what it turned out to be now. And so we're learning a lot in this relatively short period of time, learning from other states and CDC and just our own experience. But I will say, we have heard from pediatricians who have testified about the need to get our kids back in school, and to think that we have 80,000 kids back in school right now and a relatively low number of cases that are developed as a result, in some respects is good news because they weren't doing well. We heard that time and time again from the pediatricians and experts and educational experts as well, that our kids were not doing okay. So now putting them back into a school environment has been beneficial to them, and again, with the masking policy that we have, I think that it's going as well as could be expected. Dr. Levine?
Yeah, just to add on to that, great answer, actually. The bottom line is, if there's an important thing on the list of things to do, it's to not send kids to school when they're sick, or adults to school when they're sick. That's probably the most powerful intervention. Beyond that, masking is so effective that that's listed at the top of the list of the kinds of mitigation procedures you can exercise. It's not true that distancing is not on the list anymore. It's just a lesser consideration, and it directly is impacted by what the governor just said. The cost of having kids not be in in-person education are much greater than the cost of not having school because you have distancing requirements in place that don't allow you to have the class be a class. You can't fit enough kids into the space that you have. So even the CDC, who's put out sort of the textbook on this now, recognizes that and said, don't let distancing get in the way of getting kids back to school. I just want to also use your question just to take advantage of it to contextualize a few of the things you've heard this morning, because you're right, the Delta variant is very different. But even with the Delta variant, the cases we're seeing in school to this point, with rare exception, have come in from the community because that's where the virus is being transmitted. And the kid shows up in school and then it becomes a case. But the reality is, the small numbers relatively thus far, even though they may involve a large number of schools, are not closing down the entire operation and not impacting 80,000 kids in the same way that they would have been in the pre-vaccine era. And you saw our table of long-term care facilities, and there were 134, I believe, cases listed amongst about 8 facilities. Before vaccine, 134 cases would have been 1 or 2 facilities. And we would have been seeing death rates that were horrifying, and we would have been seeing potential hospitalization rates, though many of the patients weren't destined for hospitalization due to their advanced directive. But the reality was, this long-term care situation is much different. We're seeing dozens of cases in a facility, not, tens to hundreds of cases. And with colleges, they've just come aboard, so it's a little early, but we had our usual college call this morning. And yes, there are cases that are being picked up as the students have arrived here and are testing positive, but they're a very small number. They are not super ill, and they're not disruptive to the beginning of college for this semester at this point in time. And their vaccination rates are extraordinary and very laudatory. So we applaud all of the schools for what they've done and the students for complying with their mandate. Thanks.
The other question on a completely different subject matter, Governor, and the courthouse here in Orleans County is one example. but there are defense attorneys who are at this point saying that justice delayed is justice denied. The fact that this courthouse doesn't have a good ventilation system isn't a reason to continue to put criminal cases on hold until the pandemic is over, until they eventually find suitable space. Is there any reason why they can't find a space outside of the courthouse where they can hold trials and start taking care of a backlog of cases?
None that I'm aware of, Ed. And that's probably a better question for the judicial branch, 3 branches of government, judiciary, executive, and legislative, and that's under their control.
Okay, very good. Very good. Thank you.
Secretary French, did you want to answer? He may want to expand upon the first question.
Okay, sure.
Yeah, thanks, Ed. I was just thinking, just to reemphasize a couple points relative to school from this year to last year. Definitely reacting to Delta, which is a new experience. But I think, when we think about, which I think is what we're really focused on this year, is trying to balance the education policy goals with the health goals. The experience from last year educationally is accumulating for students. And as I remarked at an earlier press conference, we can't afford to have another year of disrupted experience for them, so that weighs heavily in our decision making. And I think specifically to your question on distancing, that's the mitigation strategy. As Dr. Levine said, that's in our toolkit, but it is the strategy that really gets at the heart of balancing the educational objectives with the health objectives. Because if we go to distancing, like as I mentioned previously at the high school level, that almost automatically shifts high schools into a hybrid learning mode, which isn't going to work for kids. And it's also very counterproductive to the younger students in terms of the healthy socialization that they need for development. So it's something we're aware of based on our experience, to your point, but it's also something we're really looking closely at, trying to really balance the educational needs of students with the public health needs as well.
Okay, very good. Thank you.
Tim McQuiston, Vermont Business Magazine.
Hi, Governor. Just to follow up on the UI question, the $25, is there nothing you can do between now and the legislature reconvenes in January in 16 weeks or so?
Not that I'm aware of. I mean, we're talking about, $25 doesn't sound like a whole lot, Tim, but that's really millions of dollars a year. And I think they put a cap of $100 million on it over the next several years. So this is nothing that I can think of that we can do without legislative authority.
Is there possible to reconvene the legislature before then, either by your order or by theirs, or is that even within the realm of possibility?
Do you certainly could call a special session. I don't know as it rises to to that level. I mean, that would be extraordinary from my standpoint, but I'm willing to listen.
Oh, okay, thank you, Governor.
Pete Hirschfeld, VPR.
Yeah, thank you, Jason. Clarifying question for Secretary French. We define a close contact as someone who has been within 6 feet of an infected individual for a total of 15 minutes over 24 hours. Correct me if I'm getting any of that wrong. Is the guidance to schools that if a student is fully vaccinated, then they would not be considered a close contact, even if they meet that CDC definition?
Yeah, hi, Peter. You're almost there. You did cite the definition of a close contact from the CDC, and that is the one we are maintaining. The definition around vaccination, the other variable is you must also be asymptomatic. So the CDC and Vermont guidelines say that if you are vaccinated and asymptomatic, by definition, you are not a close contact.
So then how would schools know whether or not somebody is symptomatic or not? If they're trying to decide, okay, who is it we need to reach out to, how could they take fully vaccinated people off that list of close contacts without having knowledge of whether or not they're symptomatic or not?
Yeah, I mean, it's a great question because it gets the kind of the mechanics that school nurses and COVID coordinators have been juggling. The first, again, 2 variables. One, what is your vaccination status? And then second, are you symptomatic or not? And the vaccination status has been, I would argue, part of the logjam, if you will, in the process, that previously was only confirmable by the Department of Health. So what we're empowering now are districts to use their local vaccination information, so they'll have that variable at their fingertips more readily. Similarly, the school nurses and other school officials are capable of, diagnosing, if you will, or identifying symptoms that are COVID. And as Dr. Levine said, probably one of the most important points of our recommendations this year is stay home when you're sick. So, continue to reinforce that message and have families and certainly the health folks in schools identify people who are symptomatic. But I think the issue has been largely on identifying vaccination status in a rapid manner. And hopefully we'll address that in our revised guidance.
Got it. So just to be clear, if once students have that list of who's vaccinated and who's not at their fingertips, are you recommending that they not call fully vaccinated students who have been in close contact with somebody who was infected if they haven't gotten word from the school nurse that so-and-so said they had a sore throat?
Yeah, it's a complicated question. Firstly, I think, what we're proposing is informed by the contact tracers and the health expertise of the health department. So, part of it is to get, again, at this sort of immediate issue of identifying individuals that are vaccinated so that can help make the process more efficient so they then can move on to those individuals that are not vaccinated. But we're also, as I mentioned in my statement today, the health department will be publishing additional template letters and so forth in the case of recess to help parents know that there might have been an exposure on a playground, but that exposure, hypothetical exposure or probable exposure, doesn't necessarily translate in the need for quarantining. And that's the big goal here, is again to try to balance the educational goals with the public health goals and try to prevent the identification of students that are asymptomatic and certainly asymptomatic and vaccinated for quarantining when we should be focusing our efforts on other students perhaps.
Thank you all.
Joseph Gresser, the Barton Chronicle. Joseph Gresser.
Come on, Joe. Come on, Joe.
I think we got you.
Come on, Joe.
You there, Joe? I think we have you. All right, we'll move to Mike Donahue.
Thank you, Jason. Governor, I was wondering your reaction to the almost virtual shutdown by the Department of Public Safety this week for law enforcement due to its new computer system called Valcor. Apparently, everybody knew it was flawed, and even back in April when the first of 3 rollouts started. And now yesterday, the troopers got an email from the administration urging them not to be proactive, not to make traffic stops, not to use the radio, not to use the phone, that the dispatch centers, the 2 dispatch centers, are virtually flooded. And essentially some of the local police departments that were on the old system, Spelman, have apparently gone back to paperwork because they can't get through. They make traffic stops and they're waiting for the system to work. I'm just wondering, I mean, you've obviously been, I assume, updated about this whole situation, but, the department was warned back in April. They didn't want to hear things, I'm told, and I was actually told one of the dispatchers who warned about the Valcor system was pushed off a committee because they didn't want to hear that. I'm just wondering your thought about the administration telling people for the next 48 to 72 hours that they had to limit their use of the Valcor system and reduce motor vehicle stops and so forth.
A lot to unpack there. I think I'm going to ask Commissioner Sherling to comment first before I comment.
Okay.
Good afternoon. There is a technical issue that has arisen beginning late yesterday, and our team is in close coordination with developers, the folks in the communication centers, and the Agency of Digital Services to work to resolve the slowdowns on a system that has just gone live, as you observed on Sunday. In terms of the remainder of the premise of the questions around warnings about the system, I would beg to differ on whether there have been any concerns about the ongoing rollout to this point.
Well, I was forwarded an email that apparently came from DPS or from state police that says Valcor is currently experiencing tremendous slowdowns based on several factors, including heavy loads on servers. Valcor technicians, DPS officials, Agency of Digital Services are all aware. And then it goes on, over the next 48 to 72 hours, we need everyone to limit use of Valcor while their technicians work to improve the system. This includes reducing all proactive activities such as motor vehicle stops. Additionally, during this time, it's important we try to alleviate any pressure on the PSAPs, including radio traffic and phone calls. So you knew back in April that the system was flawed. The second rollout came Sunday. There's a third in October. Governor, you have any thought on halting the rollout of the third part of the rollout?
If I may, just a moment, Governor. Mike, the premise of your question is skewed. The system's been in use for over 11 years in Vermont. There have not been any substantive issues with its performance. So any characterization of known issues prior to yesterday is simply untrue. We're working on a three-pronged strategy. The first is coding updates. The second is adding server resources. And the third is outlined in what you just read, which is reduction of load over the near term. So it'll be fixed and things will move on.
Where did the Valcor system come from? How many bids did the state get? And how much are the taxpayers paying for this program for the state of Vermont, Governor, if you know?
I don't have that off the top of my head. I know that as we enter this digital age, we are constantly trying to improve processes. We're relying on IT for almost everything these days, as we've shown in the Department of Labor, for instance. We have a 50-year-old mainframe that needs to be replaced and enhanced and improved. But we've become so reliant on that, we have to continue to utilize that infrastructure until we can build upon that to make it better. The same holds true for the 50-year-old system, legacy system in motor vehicle. So we are moving forward with that. Valcor is no different. That's, again, 11 years old. It needs constant updates, constant improvements, as we know with our own systems. I'm sure, Mike, this would be like going back to just having pad and paper and transcribing all your notes to a typewriter. Everything has changed these days in how we communicate, how we develop our information, and how we report. So again, during this brief period where we've had an issue, going back to some missing is something that has to be done, and we're doing it, and we'll have this the system up and running shortly. So again, anything we do with our services and so forth are typically a bid process, but I don't know the particulars of this one. But we'll certainly, I can get Secretary Young to connect with you and describe that.
Okay, because obviously it impacts fire and rescue squads also apparently are being forced to switch from the Spellman system to the Valcor system if they're dispatched through state police. Maybe the commissioner can outline where the Valcor system came from and how much they're paying, the taxpayers are paying for, and how many different agencies are how many different companies were considered for this upgrade?
I believe there were 6 bids. This goes back to sort of the middle of COVID, so we'll have to reference the documents for the details. Be happy to provide that on request.
And where did Valcor come from?
It's built by a company called Crosswind Technologies. It originated in a public-private partnership in Burlington in 2010.
And were you part of that?
Yes. I think you're well aware of that, Mike.
Just wanted to make sure. Are you still part of it?
In terms of part of it, I was the chief in Burlington when we acquired the system. I have not been part of anything to do with public safety IT for about 7 years.
Thank you.
Ann Wallace Allen, 7 days. Ann, 7 days. All right, we'll move to Greg Lamoureux, the County Courier.
Good afternoon, Governor. Last week, I asked you about mask mandates at public meetings. You mentioned that you'd probably be looking into it with legal counsel in your office. I wonder what you've discovered since.
I have not. I did bring it up with our counsel, but I haven't followed up on that at this point in time. And I think I suggested you contact the Secretary of State. Maybe you could tell us what you found out.
Correct, I did, and I did a pretty lengthy story on it. I was more curious what you found out, seeing that you were happy to point out that it was a division in government. So I wanted to find out what your branch of government thought of it.
Yeah, again, I haven't followed up with our general counsel, but it's on the to-do list. And I'll have to pick up a copy of the Courier to find out what you found out.
All right. This may be for Commissioner Harrington. Had a local Vermonter reach out, and they've spent the better part of the year trying to work with the Department of Labor in regards to lost payment from a program called the Lost Wages Assistance Program. Apparently, the department cut a check to them. It was never received. They've had a very lengthy time trying to get that paid. In the meantime, tax season came around. The department said, here's a 1099-G. You still have to pay the taxes on the money even though you haven't gotten it yet because it's income from 2020. We're now pushing almost a year since this person was supposed to get paid. And add insult to injury, they've had to fork out tax money on income that they haven't received. Tax money that presumably some of it went to the state of Vermont. I'm wondering, where do people go when all of their calls to the Department of Labor have gone unanswered or at least no solutions?
Commissioner Harrington, I think I said this earlier, is in a hearing with the legislature at this point in time. The Deputy Commissioner DeGree may be on, but I'm not sure that he can answer that, but I'll give it a try.
Sure. Thank you, Governor. This is Deputy Commissioner Dustin DeGree. Greg, that is unfortunate. The LWA program was the supplemental program that the President instituted towards the end of 2020 via executive order. It was a short-term program. It is possible, certainly, that this person has fallen through the cracks. If you would be willing to share with me their information, Greg, we'll make sure we get in touch with them and try to provide that person some answers.
Certainly, and I guess I'll follow up on it next week. I guess lastly, this may be for Education Secretary. With the caveat that nothing's been finalized, what do you expect to see for winter sports this coming year?
Hi, Greg. As I mentioned earlier, we're working on that now. We have I would say, a fairly disciplined approach to doing this sort of decision making. We evaluate each sport for its risk relative to COVID, and we're also certainly very aware of the Delta environment and what mitigation strategies we have in our toolkit, including vaccination and surveillance testing. So too early to tell, but we are hoping to produce some recommendations in early October.
Well, presumably there's been some discussion, so I'm just trying to find out, like I said, with the caveat that nothing's been finalized, what are some of those discussions? Are we talking even of a possibility of fans attending games this year, or, has that already been cut from the options? I'm just trying to get a rough idea what you're looking at and what some of the discussions have been.
Yeah, I appreciate the question. It's definitely too early to describe that. Again, we have early October in mind precisely because we know people need to have some forewarning of how to implement the recommendation. So it's a little too early, but we're happy to talk more about that in early October.
And Secretary Curley's on the line, and she might be able to provide a little more context as well.
I do. Yeah, I definitely don't want to speak to high school and middle school sports and step on the toes of the education community, but wanted to try to tackle this from the perspective of the current situation on the ground. Right now, activities like singing and theater and sports are permitted. We don't have an emergency order or anything that would not allow people to be playing those sports or enjoying the arts as they wish. But again, we remind people to take a peek at the Department of Health website, where we talk about recommendations around when to mask, particularly indoors, where there are people who are unvaccinated, whether they can't be vaccinated or have chosen not to be. So those are really important pieces to follow. But for now, I think, we obviously want to offer hope and say that unless the situation changes drastically, and again, Dr. Levine weigh in on this, that we expect that people will be able to enjoy those activities that they love so much. But again, as Secretary French said, there are some different strong recommendations in the school system, and for the school sport, there need to be some additional conversations to make sure that the recommendations line up with what the expectation is in the school system.
All right, thank you.
Chris Mays, the Brattleboro Reformer.
Good afternoon. I have two questions for Dr. Levine. I was wondering if you could give your opinion on the use of ivermectin for COVID treatment or prevention, and I also wanted to know if you or the Department of Health are hearing about the drug being used for COVID at all in Vermont.
He answered this last week, but I'm sure it hasn't changed much.
That's correct, Governor. It's received a lot of press lately, but I do have to say the medical and scientific community are being pretty unified on this, that it has not been shown to have a role for human beings in treating COVID-19 or in preventing COVID from occurring. And I would urge those who are seeking to avoid vaccination but find something else that might be magical to help them, that this would not be the path to go down. And it's because of what you just mentioned that there have been numerous reports in the medical literature about significant adverse effects from people taking ivermectin, which is often dosed for horses and cows who weigh a lot more than human beings. experience in Vermont, I am not aware of anybody who has been treated for severe adverse effects. That doesn't mean it hasn't happened. I'm aware of that.
Thanks.
Michelle Monroe.
Thank you, Jason. My question is actually for Secretary French concerning whether or not the State Board of Education might consider changing its position on not counting education that's happening remotely while students are in quarantine. Because we're certainly seeing at the elementary level that entire classes are being forced into quarantine by a case in the classroom. And what I'm hearing from administrators is that teachers are continuing to work with those students remotely, because to do so for 7 to 10 days while all those students get tested would adversely impact their education, yet the school doesn't get credit for attendance for those kids.
Yeah, thanks for the question. I think, firstly, the State Board hasn't taken that issue up, so I can't speak for them. But I think it remains to be pattern of the school year will be, and there is, even if the regulations don't change, there is an opportunity for a waiver request that exists under the current regulation that we might see districts trying to leverage. That waiver process doesn't kick in until after the first of the year, however. So we'll have to wait and see. But the State Board, I believe, hasn't taken up the issue yet.
Thank you. And also cafeterias. They were remaining, the guidance is allowed for resumption at cafeterias, and that's certainly one of the areas that's being raised in the revised guidance. But keeping, it seems to me that children, unvaccinated children in an area where together they're not masked, it's very hard to keep them from wanting to interact, particularly young children, actually even middle school children. So is there a chance that guidance may change around cafeterias and allowing use of cafeterias for unvaccinated students?
Yeah, I think your question raises the issue of balancing the educational goals with the health goals, and cafeterias. Firstly, schools have other places they can use other than cafeterias. But cafeterias are important social environments for students as well, and it's often a time where they, say, blow off some steam, but they're allowed to relax a little bit in a non-academic way and connect with their peers, and that's an important consideration. We'll certainly, as we are monitoring the contact tracing in particular, if we see patterns that are directly pointing to cafeterias as being a source of, problematic spread of the virus, that would be something we'd be focusing in on, but we're not seeing those patterns right now. In our recommendations, firstly, when they are in cafeterias, certainly they're removing masks when they're eating, but other than that, we do recommend that they move through that process as quickly as possible and put their masks back on, or at least get back to another environment where they can safely engage with one another. But to your question, I think it remains to be seen. We monitor the data very closely, particularly from contact tracing, and if we saw a pattern, we would consider recommending some further steps.
Okay. Thank you. And then I had a question for Secretary Smith about testing. An Islands resident reached out to me about wait times for testing in the islands. She was saying that it took her 5 days to be able to be tested in the islands, and certainly that's a concern when we have kids who need to be tested on their 7-day mark, and testing is limited in the islands. So is there any potential solution other than Islands residents are going to have to go to Franklin or Chittenden counties if they need to be tested more rapidly?
Let me look into that. I hadn't heard of the islands in particular having those sort of issues, but let me look into that and I'll get back to you. How's that sound?
Okay, terrific. Thank you. That's it for me. Thanks, gentlemen.
Michael Doherty, VT Digger.
Thank you. I want to jump back to school surveillance testing. According to the figures that you provided, a month into the school year, about half of all school districts still won't be participating in this. School districts that we've talked to have said that they're struggling to staff this effort. And in other cases, they're saying that problems with either the state or with CIC are delaying their ability to actually roll it out. I wonder, why isn't the state doing more to accelerate this process?
Hi, this is Secretary French. I think, the issues you raised are ones we're aware of. I think it's, in terms of accelerating the process, it's a really hard time of year, again, particularly with the work that's going on around contact tracing, to expect the process to move any quicker. But again, we do want to emphasize that surveillance testing had played an important role for us last year, and it will play an important role going forward. So we're definitely very interested in resolving any kind of logistical considerations. The ones you mentioned are ones we've heard as well. But again, I think it's also really, it's kind of unrealistic to expect schools to deploy this any quicker at this moment of time, and I'm sure we'll make a lot of progress as we get past the opening of school.
It seems like in a lot of cases, though, the schools themselves are certainly, yes, staffing on their end is an issue, but we've heard specific reports that it's specifically with the state or with CIC that they're not able to get the resources that they need. Schools that really want to roll this out sooner and stand it up sooner.
Yeah, I mean, there's a tremendous demand for testing right now, and CIC is a regional vendor. They're seeing that demand, and they're very, they're working hard to ramp up their support as well. And we're definitely taking concerns from the district and taking them into our process improvement model and doing what we can to make it work better for everyone. But it's a bit of a logjam on testing right now, and we have to make it work better.
Okay, thank you.
Yeah.
I had one other question related specifically to the number of fatalities that we've seen so far in this surge. In the modeling reports back in early August, there had been a forecast of, looking at a maximum of around 6 deaths for the month of August, and I think we ended up at 18. So far in September, we've seen 13. Certainly these numbers seem a lot higher than what had been forecast. And there hasn't been a forecast included in the modeling report, so I'm curious, what should Vermonters be expecting for the next 6 to 8 weeks? What are you forecasting in terms of the number of people that are likely to die from COVID in this time period?
Mr. Picha.
Thank you, Governor. So, Mike, just wanted to point out that we do continue to include Fatality Forecast in the online version of our presentation, which is the sort of full 60, 70-page presentation. It's the CDC ensemble that puts together a bunch of different forecasts and gives an expectation for Vermont. You are correct that in early August, going into the Delta wave, we anticipated, that those deaths might be a little higher than July, but not as high as they eventually got. We did revise that forecast in the month of August up to, a range of, I think it was 15 to 18. Right now, we currently have 19 deaths for the month of August, so it was certainly in that ballpark. For the month of September, if the expectation is that cases, will eventually come down, we're hoping that the trends on the case side are reason to be optimistic. As we know from previous waves, it takes a little while for those hospitalizations to follow suit. And then unfortunately, deaths is a lagging indicator as well. So, the CDC forecast, I think, generally shows that the median expectation is that maybe we would continue to see 5 to 6 deaths a week, sort of this pace that we're on right now. But certainly as you get toward the end of the month, if the cases come down, you would expect the fatality rate to come down as well.
It seems like 5 to 6 deaths a week for the next several weeks could put us to where we're looking at almost roughly the same number of deaths that we saw in the first wave of COVID back in March, April, May 2020. I wonder just how can we kind of contextualize that? It seems unusual to think that at this stage of things that a surge in cases would be seeing the same same number of fatalities that we saw back in 2020.
Yeah, so I think there's a couple of points. One, when you look at the overall fatality rate for the entire pandemic, Vermont is now tied with the lowest number of fatalities per capita with Hawaii. So Hawaii had been considerably ahead of us, and through this Delta wave, unfortunately, their experience has not been as good as ours, and they've seen quite a few deaths. So other places are certainly seeing an increase in fatalities. Vermont, like I said, is one of the lowest in the country through the Delta wave, the lowest through the entire pandemic. When you look at the not just the spring surge in 2020, but the winter surge in 2021, obviously you see a lot more fatalities at that point in time than what we saw back in March. And I think really the difference is obviously it's a different virus now than it was back in March 2020. Obviously, we shut down almost every aspect of our lives in March of 2020 in a way that was pretty significant. So it's just a different time now, certainly a different virus, but certainly also the protection of the vaccines as well. And we see that the case fatality rate for those who are fully vaccinated obviously is very, very low, and I think that's the key message for people to take away.
Okay, thank you.
Guy Page, Vermont Daily Chronicle.
Hello, Governor. Does the Vermont Department of Health keep records of the identities of vaccinated Vermonters as reported by healthcare providers? And if so, how will this information be used?
I believe they're all gone into our electronic records keeping, so we do keep them. So I'm not sure how it would be used other than for data, but I'll let Dr. Levine answer.
Yeah, there is an immunization registry, and so we keep track of all immunizations in the state through that. There's also an opportunity if a person is in someone's doctor's office and they're not sure if they had a certain immunization and they're able to get it, that doctor can check records to see if the person has actually gotten the immunization and hence doesn't really need it all over again. Or if they're eligible to have certain immunizations. So it's used in a clinical sense in that way. Obviously, in aggregate, it's used in a population level as well, and reporting back to the CDC, and in our state keeping track of rates of immunization with various vaccines. So we have an idea of how much of our population has received one vaccine versus another, which go into important public health decisions.
But you don't expect to be reporting those numbers, the identities, the names to the CDC?
No, no.
Governor, your opioid overdose response a few weeks ago addressed pandemic isolation, but did not address the year-over-year decline in prosecution of illegal opioid dealers, as shown in the health department dashboard. Would your administration advocate for more aggressive arrest and prosecution of dealers as a path to reducing overdoses?
Yeah, I think it's a multi-pronged approach, and I think enforcement is one of those, one of the three legs of the stool, so to speak. So, yes, we continue to advocate. In fact, I think there was a significant event in the Northeast Kingdom this past week.
Yes. Yeah. Okay. Thank you.
Thank you.
Tom Davis, Compass, Vermont.
Thanks, Jason. Governor, the administration, I just have 5 of your favorite words. No questions. Thank you. That's more.
Andrew McGregor, Caledonian Record.
Yeah, good afternoon. Thanks for sticking so long beyond your scheduled stop time. Probably for Secretary Smith, concerns from Northeast Kingdom school nurses with the availability of testing and the turnaround times for results. I'm being told it's taking nearly a week for some tests to come back. There's no testing capacity in the Kingdom on Sundays, at least according to the health department sign up, none on Saturdays in Orleans County. And it's pretty discouraging to school staff that are trying to manage and keep kids out when it's so hard for families to cope with what essentially is a 2-week absence from school. And the last thing is wait times, even when you can get an appointment, cars at the drive-thrus waiting for as much as an hour, and hearing anecdotally about some vehicles cutting line and there being minor confrontations between drivers waiting for their turn to get tested. So just thoughts and reaction to whether there's testing concerns here in the Kingdom.
Yeah, thank you for bringing that up, and we'll certainly look into that. You know, one of the things that I had mentioned that's different that we had done during a low period was we're allowing walk-ins for the various testing sites. And that is in a high, sort of a higher virus prevalence time. That is causing some problems because we staff up for certain capacity and then all of a sudden we have walk-ins. So what I am doing is encouraging Vermonters to make reservations. And like I said, appointments. And like I said, if we see shortfalls, and I'm glad you brought this up, if we see shortfalls, we'll add capacity. We look at all the testing sites almost on a daily basis to look at capacity and how they're doing with capacity. We will continue to do that, and we will add capacity. We will add testing sites if we need to. And then lastly, we'll look at other ways. For example, you brought up students, maybe a self-administered test at the home, maybe a way to look at that. We'll look at innovative ways that we can address any of those issues along the way. Like I said, we have 33 state testing sites in addition to 21 pharmacy sites, and we do test a lot in this state, 36,000 tests over the last 7 days. That makes us, fifth in the nation in terms, or in the top 5 in the nation. Sometimes we're number 1 in the nation in terms of testing per capita, or testing per 100,000. So I really do appreciate that. Give me a chance to look into it.
Okay, thank you.
Fiora Engel-Smith, Vici Digger. Leora, I think you might be muted.
Sorry about that. Months into the pandemic, and here we are. So the question is about the wait time inquiries that you guys started. I want to know how it's going, because I think you guys announced it maybe 3 weeks ago. And then I was wondering, when do you guys plan on releasing your findings for this sort of?
Sure, thank you for the question. We have had several discussions between the 3 entities, the Department of Financial, the Green Mountain Care, and the Agency in terms of this investigation. I think you'll start seeing some of that movement in the next week or so as we start moving and asking questions in terms of looking at this. I'm hoping that we can wrap this up by the legislative session, at the beginning of the legislative session. And the reason for that is because I want to be able, if we need legislation, to be able to introduce legislation at the beginning of the legislative year and have it go through the legislative process in a very, very thoughtful process as we move forward. So that's the time frame of wrapping this up, and also what we've been doing in the last few weeks of looking at the data that we have now, looking at what we're going to need to fill the gaps in that data, and looking at what we're going to be needed in terms of personnel and to do this investigation.
And so what, in the meantime, for folks who are waiting for specialists right now, what should they do? And because it does seem kind of like it's gotten very, very serious.
Well, it has, and we're trying to work as expeditiously as possible. I've seen the letter from UVM in terms of what they sent in response to the investigation. I was a little disappointed in the letter because it talked about what other people need to be doing, but it didn't talk about what UVM should be doing, what UVM should be doing in terms of how they should be changing their practices in terms of procedures or operational procedures that they should be changing to address this. It didn't talk about any sort of changes in management. It didn't talk about how they can attract and keep and retain talent in that organization. And they talked about the various aspects of funding when in fact, we as an agency have funded the UVMMC $72 million, almost $73 million in the Healthcare Stabilization Fund, as well as we had a sustained monthly program that we contributed $3.6 million. That total with the Health Care Stabilization Fund and the sustained monthly came to about $73 million that we provided. We've provided problem instead of sending memos that just lay it on one side.
And so for now, we're gonna have to wait for the findings, but it sounds like maybe you have some gripes with UVM.
No, I think we've had it system-wide. We're looking at this system-wide. It's not only UVM. The reason I mention UVM is because they sent the memo. But secondly, I think the other factor is they are the big, they are large in comparison to the other systems. And so I think you'll see that we are going to be fair. We don't want to punish people. I've said this multiple times. What we want to do is fix the problem. And so, Commissioner Pichek, you want to add to that?
Yeah, I just wanted to add on to the point about what should Vermonters do at the moment. The investigation, as Secretary Smith said, will unfold over the next number of months. But our department does have regulations in place, at this moment that says those with commercial insurance, so Blue Cross Blue Shield, MVP, Cigna, that you must be seen by a doctor within a reasonable time. If it's an emergency care, that's 24 hours. If it's non-emergency, it's 2 weeks. If it's preventative care, it's 90 days. So if you're not being seen in those windows of time, you have the ability to go add a network at the same price and get care. With telemedicine, that becomes a little bit easier because you could do that potentially from your own home. Obviously, it's not the solution to this problem. It's just something that Vermonters should be aware of and take advantage of while we look into it further.
Thank you. I appreciate it.
I'll just add one more piece of advice I received from one Vermonter in the past week. They had been waiting for a specialist in a couple of different areas for the last few months, 2 or 3 months, and couldn't get through and couldn't get an appointment. So they went outside the network, went to another hospital, and got in within a week. So you might want to search around a bit. There may be different hospitals around Vermont that may have an opening for you. So you may want to at least explore that. And this person was well satisfied.
Thank you.
Okay, thanks very much. Reminds me of the old days, 2 hours and 15 minutes, and we'll see you again next week.